The United States healthcare system is very complex. Unlike other industrialized countries, the United States does not have a universal healthcare. There are many different healthcare systems within the United States that serve different populations throughout the country. These systems include Indian Health Services, County Health Services, Critical Access Hospitals, the Prison Health System, and the Veteran Health System, among many others. Taking care of veterans in the United States can be traced all the way back to 1636 and the Pilgrims. The colonists were the first people to pass a law in the United States that stated that disabled soldiers would be supported by the colony. During the Revolutionary War in 1776, Congress promised that those who enlisted to fight the British and were injured receive pensions. Around 1811, the federal government authorized the first medical facility specifically for veterans. During the same time, the Veterans Program was extended to cover not only the disabled veteran, but also their dependents and widows. As history went on, Congress established a new system of benefits for veterans, including disability compensation, insurance for service personnel, and veterans and vocational rehab services for disabled veterans. The Veterans Health Administration came from the Civil War era. In 1965, President Abraham Lincoln enacted a law that would create a National Soldiers and Sailors Asylum. This was renamed in 1873 to the National Home for Disabled Volunteer Soldiers. It was the first ever government-funded institution created specifically for honorably discharged volunteer soldiers. When the first home for disabled soldiers opened in Augusta, Maine, only soldiers who fought for the Union Army and the U.S. colored troops were allowed. These soldiers' homes became the basis for the foundation of the federal veterans hospitals. The Veterans Health Association operates one of the largest healthcare systems in the world and provides training for a majority of America's medical, nursing, and allied health professionals. The Veterans Health Administration medical facilities provide a variety of services ranging from inpatient hospital services such as surgery, outpatient services such as dental and vision services, and rehab services such as physical therapy. Since 1930, when the Veterans Healthcare System only composed of 54 hospitals, it has grown to include 152 hospitals, 800 community-based outpatient clinics, 126 nursing homes, and 35 veterans homes.
The Veterans Health System serves a multitude of people. Simply put, if a person has served in active military and was not dishonorably discharged, then they may qualify for benefits through the Veterans Health System. This VA certificate of eligibility easily displays who can qualify for benefits for the VA. Most veterans who enlisted after September 7, 1980, or entered active duty after October 16, 1981, must have served 24 continuous months or the full period for which they were called to active duty in order to be eligible for benefits through the VA. There are roughly 150 Veterans Affairs hospitals, 820 Veterans Affairs community-based outpatient clinics, and 300 Veteran Affairs vet centers that offer counseling, suicide prevention, and other services. The VA hospitals served roughly 5.69 million patients in 2013. As of 2013, there were 8.92 million people enrolled in the VA healthcare system. The population of veterans served by the VA is approximately 90% male, 10% female, and almost 45% of the people served are 65 years or older.
Now we are going to talk about the economic factors that led to the creation of the VA healthcare system. The United States economy does not play a huge role in the veteran health system. According to a 2011 survey of VHA enrollees, 77% of them have a non-VHA source of healthcare coverage. The veteran's decision to purchase outside coverage is largely influenced by the economic circumstances at the time of purchase. However, there have been a few studies done that show there is a small connection between the economy and the Veterans Health Administration, better known as the VHA. A 2014 study about the veteran population in Massachusetts showed that the Great Recession, which took place from December 2007 to June 2009, helped in growing the enrollment in the VHA. A health economist at the VA Puget Sound Healthcare System, Edwin Wong, and his colleagues found that VHA enrollment in that state grew from about 3% of veterans to 12% of veterans during the recession between the years of 2008 and 2010. The following graph shows the trends between the veteran unemployment rate and the number of non-elderly VHA users. Another study published in 2015 showed the connection between the VHA and the economy in more detail. It showed that when unemployment rates increased, less veterans were employed, thus reducing the number of veterans enrolling in employer-sponsored health insurance. This caused veterans who did not have health coverage through work to turn to the VHA for insurance coverage. Austin Fracht, a health economist at VA Boston Healthcare System, and his colleagues also found that VHA enrollment and use of outpatient care grows with the unemployment rate. Reductions in housing prices are also a sign of fewer resources with which veterans could purchase health insurance or care, again making the VHA a more attractive option.
The creation of the current Veterans Health System has been molded and modified over time, dating back to 1636, where the Pilgrims of Plymouth Colony passed a law stating that any disabled soldier would be supported by the colony. Since then, we have adopted new policies and procedures in an attempt to better our Veterans Health System. Most of these changes to the system have followed times of war. After World War I, the U.S. Congress created a new Veterans Health System. This new system offered many benefits which focused on social issues. These benefits included disability support, compensation, insurance, and vocational rehabilitation for those who are disabled. These benefits allowed veterans to be able to transition back into society after serving in the military.
The United States Government Accountability Office conducted a study on the Veterans Choice Program passed by Congress in the year 2014 and found in the year 2016 veterans waited on average 64 calendar days from a VHA contract provider to receive care. A veteran seeking routine visit could wait up to 81 days at a Veterans Health Administration facility. This study shows that more vets are receiving care, which is the overall goal.
Shortly after the Civil War, President Lincoln took action to help our veterans. He created an asylum for soldiers who were honorably discharged. This was the first government institute of this kind. Then came along World War I. With any war, there's always an increase of veterans in need. Congress had an idea to expand our services. They put two organizations in charge of leasing hundreds of hospitals specifically for those returning from war. They were also in charge of making plans to rebuild more hospitals for the future.
Veterans navigate the VA's healthcare system through the VA Health Benefit Program. Applicants can submit an electronic application and receive assistance over the phone, or apply at their local VA healthcare facility. The Welcome to VA program includes assistance with healthcare inquiries and assistance with scheduling the first appointment. Additionally, veterans will receive a Veterans Health Benefit Handbook. The Veteran Health Benefit Handbook includes information about benefits, frequently asked questions and answers, contact information for the preferred facility, and any copay responsibilities. Part of the VA Health Benefit Program is the Virtual Lifetime Electronic Record. This electronic record follows each veteran wherever they go in the United States and allows the VA, community care providers, and veterans access to the record wherever they are.
Next, we're going to talk about the strengths of the Veterans Health Administration healthcare system. The VHA has some amazing strengths. One strength is that the Veterans Health Administration is not a fee-for-service provider, meaning that quality of the care will always come before the quantity of the care. Another benefit of the Veterans Health Administration healthcare system is that they do not practice defensive medicine. This means that patients will never have to worry about their plan of care and the purpose of the tests that they take while receiving care. Recently, Congress passed the Veterans Affairs Patient Protection Act to address reports of abuse and to punish Veterans Affairs managers who ignore, intimidate, and retaliate against whistleblowers. This act allows providers to freely protect themselves. The VHA is so strong because they take the time to recognize issues and to find solutions, making them an ideal healthcare model.
Next, we are going to talk about the weaknesses in the Veterans Health System. It is a corrupt system that needs to be reformed and reconstructed to better the lives of the veterans. Our veterans are waiting way too long to receive the care that they deserve. They have to wait because of poor management and communication, untrustworthy relationships among the staff, lack of accountability and organization, and more. The veteran health system is going through many changes to better its reliability. It is starting to adapt to outpatient settings, acquire better technology to accommodate the younger veteran population, and accommodate to the new and growing female population. These veterans have a high risk of developing a mental illness such as post-traumatic stress disorder. With so many veterans developing mental illnesses, the veteran health system needs to recruit more mental health care providers to help them recover.
As shown throughout the video, the Veterans Healthcare System has many benefits and disadvantages. The current VA system is a direct result of decades of changes based on social, economic, and political influences. These years of change have made it easier for veterans to navigate the VA health system. Overall, this system has done amazing things for our veterans in need and will hopefully continue to improve. Now please enjoy a short quiz.